What's up guys, Dr. Greg here at Paramount Chiropractic, and we're talking today about some of the common causes of knee pain. Some of those big ones that kind of just jump right out of the gate here are the sports injuries like ACL tears, PCL tears, MCL tears, like I did myself playing college hockey. Took a knee-to-knee hit, tore that MCL right on the inside of the knee. So if you've had sports injuries in the past, or you've had some work injuries, ACL can be one of those big ones. Now, anatomy-wise, it lays right under the patella, coming from the femur down into the tibia. And these get injured mostly from rotational forces, where our leg is planted and we twist and rotate. The knee only has about 5 degrees of rotation, and that can cause that tearing of that ACL ligament that holds your knee and stabilizes your knee from moving forwards and backwards. The one that I did was my MCL playing hockey. Took a knee-to-knee hit and had a grade 2 tear. And these ligaments here, MCL and LCL, keep your knee from going left and right. So these are huge. MCL is a huge ligament to stabilize your knee, but it can become injured just like any other tissue in the body. The next one would be a meniscus injury. And these can sometimes go hand in hand. Unfortunately, you have like that unhappy triad, they call it, with the ACL, meniscus, and MCL injury can happen all at once. When you have that torquing or twisting motion of the knee, it can tear the meniscus, the medial meniscus and lateral meniscus. Meniscus injury might feel like pain with squatting up and down stairs, can be really painful. Bending the knee, loading the knee like that, coming down, putting that forceful stress or force on the knee joint itself. Meniscus might pop, click, lock on you. Those are typically symptoms of a meniscus injury. Some of the repetitive stressors of the knee, if you're a runner or an athlete, you can get that patellar tendonitis, which is right through here. Your patella tendon forms from that quadricep muscle, runs across the patella, and inserts on the front of the tibia. So too much wear and tear on that patellar tendon can get pretty aggravated and inflamed. We have great technology in here with the SoftWave and our laser that can help knock that inflammation out and help your patella tendonitis heal pretty quickly. If you are struggling with that. The biggie here when we do a lot of our knee pain program is the osteoarthritis, that wear and tear of the knee joint that just kind of breaks down over time. And we've all got our stressors, whether that's, and we've had previous trauma, sports, wear and tear. A lot of times nowadays we're sitting too much and our knee gets in this flexed position a lot. There's a lot of tension that comes through those tissues when they don't move properly and biomechanically. So these things can add up over time. And if we don't have the proper movement and stabilization of our knee, it slowly starts to break down. So one of the things that we do in the office is obviously like an evaluation to see what caused your injury, do an in-depth history. We want to find out the root cause of why you're dealing with these knee issues. It could be as simple, maybe there's just some inflammation in there from some overuse, or the wear and tear over time with like an osteoarthritic type of knee. A lot of times people come into the office where they've been to the ortho, they've been to the medical doctor, and they're just given steroids and drugs, and they're told they're bone on bone. They're going to have surgery and a knee replacement. A lot of times we can prevent that from happening with the things that we can do in the office, along the lines of our knee on track, our laser, our SoftWave, adjusting the knee, our trigenics program to help the knee fire and stabilize properly through that brain-body connection, and your neurology, which controls all the tissue in your body. So we want to make sure from all aspects here, we're taking those into account to make sure that we can really help your knee heal and function better and prevent these surgeries and injections that a lot of times aren't just fixing the issue. So if you guys are struggling with knee pain, you've had knee injuries in the past, you're curious if we can help you out, give us a call. We'd be glad to check you out and see what's going on.